Okay, folks, I think we're on air, and I think tonight is the 2nd of June. I hope you had a good weekend last week, Memorial Day. I know I did. Got to go camping and got to see some forest fires and just had a good time. But welcome back to the Live Cancer Show. And I'd like to tell you that if you're new with your diagnosis, if you're confused about what's going to happen to you, or if you're confused about what to ask the doctor, or you just simply can't sleep at night, then I think tonight's show is going to be your show. And I have to tell you that Christmas comes twice because I got to meet these ladies a couple of weeks ago. And oh, you've already jumped on. But we had a blast trying to get everything worked out, and we just couldn't do it. So luckily they said, let's come back and let's do the show again. But if you had any of those things, the fear, the anxiety, or whatnot, we have Lucy Barlow and Sharon Crews on tonight. They're better known as the CHEMO Girls, and they have some programs that are going to help you out. They can help get you successful in that oncology office. They can help ease the pain or the anxiety so that you sleep at night, and I think you're going to really like this tremendously. So, Lucy, Sharon, say something so your face comes back on.
Thanks so much for having us on tonight, Roy.
Yeah.
Hi, guys.
So, you guys are kind of experts or pros. You've been at this for a while. Why don't you tell me about what happened in the very beginning? What happened to you? How'd you get involved with the work you do?
Well, I guess it started originally with me.
Yeah.
I was a 34-year-old newlywed who was diagnosed with cancer, breast cancer, and very aggressive form. And so, treatment ran the gamut. We did surgeries and chemo and radiation and more surgeries. It was very successful, but I was the girl that, they should have read all the fine print to me. All the things that rarely happen, I was that girl. Those things happened to me. So anyway, but that's been, gosh, this summer will be 12 years ago. So I found myself in the position of mentoring not only women who were newly diagnosed, but also family members and friends who really wanted to know what they could do to help.
Yeah.
And at some point, gosh, I guess it's been about 5-6 years ago, I put together a backpack, kind of a little bit of an inspired moment. But anyway, I put together a backpack for a lady in my community and filled it with everything that I learned through chemotherapy, all the tricks of the trade. Because by my 5th treatment, I knew how to be prepared, right? And so I just did not see why this woman needed to go in her 1st treatment not ready with the wisdom of the journey. So I jotted a little note and told her what each item was for, when to use it, little encouragement, and put it through the window. And Lucy is my professional mentor. Our friendship goes way back. And she's been my confidant for years. And I mentioned to her, what had happened. And she said, sweetie, you really ought to do this as a business because people don't know what to do,
Yeah.
And then fast forward to about 3.5 years ago, Lucy comes back into the picture.
Yeah. And with my own diagnosis,
Oh.
fortunately, it was a very early diagnosis, and so my treatment involved several lumpectomies followed by radiation therapy. But it was during the course of my radiation, one day in the oncology clinic waiting for my treatment, that, sometimes you get an aha moment
Right.
and an epiphany of what you're supposed to do. Earlier in my journey, I had felt very strongly that this was happening for a reason, this being having to deal with cancer. And this particular day, I was sitting and I was waiting a little bit longer than usual. Usually I was in and out the first appointment of the day so I could get to my office and get to work.
Yeah.
And this one day I was sitting there and this little lady shuffled in and sat across from me, and we made eye contact. And in her eyes was nothing but despair. And I felt like she had no hope in those poor little eyes of hers. and it just came over me. Oh my goodness, I am to join Sharon and do backpacks for women who are coming in for chemotherapy. Like I said, I was fortunate. My cancer was diagnosed so early that I was able to skirt the chemo, but I feel like I've journeyed this with her. After we came together and said, yeah, we are going to do this project, and we're going to send backpacks to women all across the world, because it's a needed thing to be able to take assistance in with you. And so for the longest time, all we did was we talked about the process. We talked about what you need to know, what you don't need to know, what you need to take in with you. And I felt like I went through chemo.
She would ask me all these questions
Sharon had
that I
to go through
had
it all
kind of
together again.
mind, what's next, what happened, how did you feel, what was important, and I'd run through it, and we talk a lot in terms of she or her, and so all of it was it's based around the woman today who's reaching out to open that clinic door for her first treatment. And so that's what these stories were about. It's like, as I'm walking through, it's like, gosh, she's going to need to know this. And oh my goodness, they're going to forget to tell her, blah, blah, blah. She needs to have that in the backpack. And as we would run through this, a lot of this ended up being kind of organizational as well, because I was a serious victim of chemo brain, and so I would say she needs a place to keep up with all of her medical information, insurance information, schedulers, journaling, a way to keep up with her medications, whether or not she's had them, how frequently to take them. I mean, there were all these organizational issues, and so Lucy would be like drawing out a chart, and it's something like this, and it's like, yes, yes, or no, let's change this. And at some point, Lucy picks up this big stack of papers and says, sweetie, this is a book. We can't just put all this in the back. And so from that process, we had already had the backpack established, but then we ended up with this book. I know you can probably barely see that, but it is all about all of this organizational. We say it's like a girlfriend who's been there, done that, wrapped up, and ready to help. But it has pockets to keep paperwork and about 3 months of charts and graphs to get you through. Following this, as we're mentoring ladies, this friend of ours, and we'll throw a little shout out to Sam Crowley, he is very much into podcasting. He's our guru, and he was telling us we needed to do podcasting. Not interested in podcasting at all, but as we would speak to women, there was one in particular who said, gosh, I would just play your video over and over so I could hear your voice. As long as I can hear you, I know it's going to be okay. Mm-hmm. I wish I could hear your voice every day when I got up. And after we met with her, I looked at Lucy and I was like, dadgummit, sister, we've got a podcast now. For about a year or two. And that's been wonderful because it's a lifeline out to anyone who is starting treatment or someone is starting treatment. It answers all those questions about what's coming, validating the way you feel, how to resolve certain issues, and then what to do afterwards, because sometimes afterwards, that's a big deal too. Yeah. What to do with the rest of your life.
Yeah.
So
go ahead.
That's okay. We just have those three aspects. The podcast is the lifelong, like mentorship. And then the backpack is preparing you for the actual chemo session. And the book is managing the rest of your life while you're going through it.
So where do people find the podcast?
The podcast is found either on iTunes or Podomatic, as well as we do have a show page. And that's www.thecancersurvivorshow.com.
I don't write very fast. Cancersurvivorshow.com.
Yes, sir.
Okay. tell you what I'll do once we get this thing off and the show will appear on YouTube for everybody. I'll have this address written above the screen somewhere up in here.
Right.
Okay. Yeah.
And the backpack again. Tell me what's all involved with that. What comes with that?
It's a lot of comfort items. We have a hot cold tumbler for things like crushed ice to help with the adriamycin and all that, or for herbal teas to help with nausea or anxiety. We have, there is a little MP3 player in this bag here, and what's on the MP3 player is both guided imagery as well as classical music. Research proves will reduce anxiety for chemotherapy patients while they're receiving their chemotherapy. And so we put some classical music, but we also wrote and recorded 6 tracks of guided imagery. And it really is just intended to meet the patient in the chair and say, sweetie, been there, been in that chair. I remember the sounds of the cart wheeling up, and, they're probably swabbing down your port, getting you ready to access. So why don't you just close your eyes, take my hands, and let's go escape for a little while. And we go to the mountains or the beach or whatever. And so that's that. We have a fantastic blanket in here. We were really, really careful to get just a really lovely, soft blanket.
Yeah.
And then we have pellet ice tray so that we can fill that up the night before for that dreaded red devil. And they can put that in their tumbler. We have a neck pillow in this bag that's inflatable. We have just like little word search, diversionary type stuff for your first session, but the book kind of schools you on how to come up with some suitable diversions for your second session, which are more tailored to your individual needs or loves. And we have lemon drops for the port flushes and that nasty alcohol taste that comes up. Some ginger drops for residual nausea. And then when it's all said and done and you've finished your treatment, this little journal is a traveling PACS journal. And the purpose in it is to just write down what you've learned and some encouragement for the next person. You repack the pack, and your purpose at the end of your treatment, when you feel like you don't know what to do with your life, one of the things you can do is mentor someone else through and be there for them, and just send that pack on and not throw it in the back of your closet. And we want this thing to be full of advice eventually, and the backpack just falling apart as it reaches as many people as possible.
Wow. Wow. I wish I would have found you ladies sooner. That's exciting.
Well, thank you. We're very excited. We and this pack will work for, we started out from our own experience base. It was for women who were undergoing breast cancer treatment. But frankly, this works for any woman going through chemotherapy. We did try to, to tweak it in that way. And we are working on a pack for men, and it is on our drawing board to redo the book for parents of children that are going through chemotherapy and doing a pack for the children.
Yeah.
Okay.
I think we share a vision with you, Dr. Roy, that one day we hope that there's not any more chemotherapy. One day we hope there's no more cancer, or one day we feel like we hope that even if we can't cure cancer, we can come up with alternative measures. But we know that is reality today. 641 women today were diagnosed with breast cancer, and a good many of those will be receiving chemotherapy, and that's who we are. Our lives right now revolve around, in our careers are meeting her so we can meet her needs as she walks through the door.
Right.
Well, the services you're offering are tremendous, because most of the oncologists just don't have time to sit down and do that, unfortunately. And
yeah. And you know, we're learning. We originally thought that our project was going to be a gift idea. You know, people don't know what to do, and so they're left buying bath salts or candles or lotions, you know, anything they can think of that's comforting. But this actually will make a positive impact on her experience. So that was our inclination. That was our how we felt we were moving. But what we've learned is that hospitals are interested in this program. And so a hospital, through the Buddy Check 12 program in Jacksonville, Florida, is now, they've purchased backpacks. They're giving them out to any woman in all of Jacksonville that's walking into chemo for breast cancer through one hospital and one Buddy Check program. And that is so exciting to us. And now we have other hospitals that are coming to us. We just had no idea, but we're delighted that hospitals are excited about this.
Yeah.
you know, I did my training at MD Anderson Hospital, and I shouldn't cover up my mouth when I say that, MD Anderson Hospital. But about 10 years into practice, I really went through a burnout phase and ended up meeting Carl Simonton, who really, in my thinking, started the mind-body approach to oncology. And worked with him for about 4 years. And what I've come to realize is with cancer fighting, you have your cancer drugs or surgery. But as the ladies from 100 Perks of Having Cancer say, that's only half of it. That's the yang part. You need the yin part, which is the quiet part. That's what you ladies are doing. And really, in my mind's thinking with my cancer patients, that's just as important, just as powerful as the chemotherapy that the oncologist gives or the surgical oncologist with his surgery. So, you know, I can't see anybody getting well without doing what you ladies are offering. It just, in my practice of 34 years, it takes that to get somebody through this process.
Well, thank you so much. We are coming to understand that what we are offering is hope and emotional support and the evidence that you do get to the other side. You know, because even though the woman opening the door for her first treatment, you know, I don't care who's with her, she feels alone unless she's with a survivor. Because that connection, they understand each other in a way that no one else can, and a patient needs that. Men need that. Children need that are going through it. And so this, for us, is just a way of opening up that mentorship into a much broader scale.
Wow. I'm kind of speechless, not because I'm just quiet, because I am quiet, but what you're doing is profound. What about your cancer book, the Me and My Chemo Cocktail book?
Yeah, that's our guide. There are a lot of different sections in it. It does involve kind of reflecting on about who you were before diagnosis and what happened in that pivotal moment when you heard that you had cancer, and what kind of change is coming for your life, trying to get a patient who isn't naturally hopeful to work through a process that can have them looking forward and seeing the light at the end of the tunnel, that sort of thing. It helps with managing all your doctor's information, insurance information. It offers a journal. And it also offers these great little stickers because, you know, people would look at me, I'd be green, or clearly I'm wearing, you know, a wig, or I'm not wearing a wig, might have been the case with me. And so people wouldn't know what to say. They'd either put their foot in their mouth, or they'd just kind of look at you in the corner of their eye. And so Lucy and I spent some time on the beach.
I'm not sure if you can see this or not. But.
Yeah, maybe a little.
I'm not seeing it on my...
Can you see that?
Yeah. Let me look on a different monitor.
Anyway, they're supposed to be kind of conversation starters, silliness really, all about being bald or green or whatever. We really not only tried to help solve issues that you're having in terms of logistical stuff, managing volunteers, how to acquire volunteers to help you bridge that gap. You know, when someone learns you have cancer, they say, you know, they're devastated, and they say, oh my gosh, sweetie, you know, anything you need, please call me and let me know. I want to be there for you. And they mean it, but you don't know what to say. I mean, what do you say? Will you please come clean my toilet? My doctor says I can't mess with the toilet, right?
Right.
I can't, you know, I can't do the laundry. Can you come do that? I just don't have the energy to haul it upstairs. We've developed these little cards that come with the book. They're hands and feet. You may not be able to see that at all. I don't know. But on the back,
yeah, that's showing up.
Okay, on the back of the cards, it kind of tells different areas that patients need help with. And so what you do is the patient puts their information on the front and highlights the areas they need help with. And when somebody offers to help, they just slip them a card and say, you know, look over this. If it looks like anything you can help with, give me a call. And then they know what you need help with, and they call, and we've got a way of organizing these people. What day of the week are they available? What are they available for? And we have ways of charting what your needs are and who's going to meet that need that day. So the book can be part of the backpack. It can be bought separately or, you know, together.
I like to call our book a chemo day runner.
Yeah.
Because it's really about 5 books in one. You know, whenever you're walking into a journey like this, you know, you need all your information about doctors in one book.
Mm-hmm.
And then you need your schedule. And then you need your medicine guide.
Your calendar.
And you need a calendar. And you need your diary. And that's what we worked very hard to achieve, was a very, very user-friendly,
comprehensive,
everything in one. So you can tote this just one book as opposed to 5 books. And the stories that we get back from women who have used their books for organization, they said, I didn't go anywhere without my book. Because it was their lifeline. It was their lifesaver to know what they needed to do and to keep track of all the different things.
We tried not to keep it just, I mean, all of that sounds very logistical, and it is very logistical, but we opened the book up with a letter to the reader, one from me, one from Lucy, just talking to them where they are at the beginning of the diagnosis. And before we go to the charts and graphs, we give anecdotal, you know, reasons why and understanding what's coming, and we do try to give explanation, and really it's just another opportunity to mentor.
Yeah,
it is. Any opportunity we get, we take it. It's in the book. So,
you know, it's very frustrating as a doctor to have somebody in the clinic who really is not really sure what's going on. And I know a lot of patients think, well, it's in the medical records, but people would be surprised how inaccurate the electronic chart is, or the paper chart, particularly when you're going between an ER and an oncologist, primary care doctor. So that notebook for me is a heaven sent. That where you record the basic things, the drugs you got and the dates you got. That's very important. And
the little pockets to keep all that information in. And we have learned from oncology nurses that they really love the journal. On the front of the journal it has, was this a chemo day? How did it go? You know, what are your blood counts? Weight? You know, how's your appetite? Are you having any side effects? But every day, how many days out are you? You know, how's it going? So when you go back and flag days and be like, you know, I can't, let me look back. Yeah, I remember my feet started tingling on the 5th day after my 3rd treatment, and I started tripping. Is that related? Yes, sounds like you're having some issues with neuropathy, you know, and they feel like it really is a bridge to sort of continue that conversation, especially with people that don't talk much, or elderly people that may have a caregiver that can keep up with the book, and then they can flip through it. You know, the nurse can, and learn a lot.
You know, we had the most sweetest nurse say one day we were with a team of nurses at a hospital, and we were talking, and they were flipping through this book, and they'd actually asked if they could take a a prototype of the book and take it up to the oncology ward and let all the other nurses look through it and give some feedback on it. So they came back to us and they said, you know, everybody loves it, but one nurse says, what are we going to do about patients that don't know how to read and write? Because, you know, unfortunately, we do have people out there that are not able to read and write. And this particular nurse said, we'll just spell it out for them. You know, while they're there and while they're taking their treatment, we'll write down their thoughts for them.
That's right. And it's just one more opportunity.
Just another way to bond with, you know, taking that medical person that's there to save their life, but to connect with them on an emotional basis.
Yeah.
That's really nice. And, you know, I've taught my patients with the support people or support groups, kind of divide them into three groups. The person that you just need a favor every now and then, or one that you need maybe daily things, pick up the kids, or the last group being the ones that you'll call at 3 in the morning. But, you know, I really like your approach with the card, with the different tasks, and you asking that person, what can you do for me? Which one of these can you do? Because when I need it, and I want to call you at that time. So.
Yeah.
Mm-hmm. Yeah, wow. And we also, as we were writing the book, we didn't know what to call it. We call it a chemo coordinator. But the chemo coordinator is that person, that 3 a.m. person, that person that knows everything that's happening, the one that you can filter everything through so you're not telling your story 500 times, the one that will, you know, keep the blog up to date on, like, with Caring Bridge or whatever, and the one that will typically go with you to the doctor to write down the answer to your questions and remind you later that it's in the book, baby, look it up, you know, we went last week and, you know, he answered those questions for you, I jotted it down. And that chemo coordinator can be, gosh, that relationship can go from a friend or a family member to something completely different. You know, sharing that entire journey with them can be a very special thing.
Yeah, wow. How are you different now than you were, say, 10 or 15 years ago?
10 or 15 years ago. Well, if you go back 15, night and day, I would have to say, yeah, night and day. That's crazy. That's before I was married. That's before cancer. And, gosh, I was in college. I was a non-traditional student. And I knew I wanted to be a speech pathologist, but I knew nothing else about my life at all. I had no idea where I was going. And to think that, I don't think you could have convinced me that I would have been through cancer, I would be married, I'd have 4 children. I mean, that girl was clueless. And she certainly was not interested in mentoring people. She did not want a podcast, write a book. She was not going to write any guided imagery, much less record it.
I'm glad you told me late in the interview that you're a speech pathologist, or that's what you wanted to do. My parents named me with 2 R's in my name, and for about 8 years, everybody thought I was Wally because I couldn't say R's. And any patient who would name their kids with an R should be shot.
Oh yeah, and almost every R kid has an R in their name. I mean, it's almost like clockwork. What's your name? You know, it's always got to have an R in it. Rachel or or you know. And Lucy is my professional mentor. So I work in her clinic part-time. She has a fantastic clinic in St. Mary's. So, yeah, you've got 2 of us.
Oh, boy. Now, what state are y'all in?
We're in Georgia.
Okay.
We're in small towns in Georgia, about an hour from each other.
Yeah. Southeast corner, right above Jacksonville, Florida, in the swampland.
Oh.
But how my life has changed, Troy, is, you know, before diagnosis, I was just really driven by my career. You know, I was adding new programs at my clinic all the time. I was always researching the latest developments in neuroplasticity and things like that for changing the brain. And I don't know. I think that it just changes you. You know, whenever you go through a journey with cancer and you beat it and you get on the other side, there's something that clicks in you that you just want to help other people. I've always been that hasn't changed to me. I've always liked to help, but it's a different thing now. I think I see life. I try to see life a little slower. Mm-hmm. You know, I'm looking forward to a little bit of slower pace, but you know, between our busy careers and the launch of Crush Your Backpack, it's a little crazy sometimes. But I think like everybody, you know, you get on the other side and you say, you know, life is just really beautiful, and I'm just going to enjoy today and not worry about tomorrow.
Learn how to thrive in the moment a little bit.
You know, I've not gone through what y'all have gone through. I've worked with people for 34, 35 years, but probably the biggest thing that changed my life was working with Carl Simonton for 4. And there is something that changes, and I notice you call it the twisted adventure, and it's hard to convince people, I think, that there can be some good, there can be some really great stuff come out of this, and it's just another trial that we have to go through. Many of us have to go through that. Others have marriage issues or financial issues or other health issues, but it is just a twisted adventure, and if you take advantage of it, there can be some really good come out of it.
Yeah. It's like catching a wave sometimes.
Yeah, nice. Well, I hate to say it, but it's getting towards the end of the time. Anything else we need to say? How people can find you, or what your website is, and go from there? We have your podcast site.
Yeah, you can find us at www.mychemococktail.com, mychemococktail.com, and the Cancer Survivor Show is www.thecancersurvivorshow.com, and then you can click on and subscribe through iTunes or through the landing page there. Would love to have everybody join us and give us feedback. There's an option on the landing page as to writing in requested topics,
show topics,
and we
will
research that and do our best at presenting some real valuable information. We've got some phenomenal interviews with some really neat people. I think we're going to have you on.
You and
I'm a guy. I don't talk. I just sit here. My notebook is going to have a lot of things for me to write because I just don't say much.
Well, and then you can also find us on Facebook, and that is My Chemo Cocktail, and use the little and symbol, me. And also we're on Twitter.
We're the Chemo Girls. At the Chemo Girls.
Yes. And we also do speaking engagements whenever people feel like, that we can be helpful. We love to do that.
That's right.
Okay. Well, folks, what I'm going to do, I got to edit this tonight. Tomorrow morning it will be up on YouTube, and along the top somewhere I'll have a lot of these addresses. So if you didn't catch the spelling or whatnot, it'll be there tomorrow night. And Lucy, Sharon, I want to thank you for being here. I want to thank you mostly for giving me a second chance to get you back on.
Oh,
and
thank you for having our pleasure.
Okay.
Did it.
Let me hang up, and the three of us will keep talking a little bit. But everybody, good night. Thank you for coming, and see you later.
Bye-bye now.
Bye, guys.